Persistent pain is a global problem. It's widely recognised how it affects physical, emotional, and psychological well-being. What we do know now is recovery is on the table. And actually, one of the simplest, cheapest, and most effective ways that someone can help themselves may lie at the end of a pen. My name's Drew Coverdale. I'm a physiotherapist. I have a particular interest in persistent pain. I was fascinated to hear that journaling could be used as an effective treatment for persistent pain. I was quite skeptical of it. So I'm here not as an expert. I'm really just explaining my transformation from that skeptic to somebody who now sees it as a valuable tool in the skill set when you're helping somebody recover from persistent pain. I initially thought it was a flying pig. It's very easy after 26 years sitting down in front of 75,000 people and asking them about pain to develop an ego that thinks knows it all can stop you seeing the wood from the tree. So I'm going to present to you what I've learned through exploring this process, so that if you think it's worthy of more of your time, I'll point you in the direction of other resources where you can explore it some more. I'm going to split the talk into three sections: the theory, perspective, and application. So theory of, how does it work? What is it that's happening that journaling does in the respect of helping someone with persistent pain. I'm going to give you the perspective of a patient who has experienced the benefits of it. It isn't one of my patients, it's someone who contacted me who knew I worked in this field. And they felt it was the catalyst for them to completely recover from pain that they'd had for 15 years. And they used other techniques as well, but I'll explain his perspective. And thirdly, we'll look at the application. If it's something you want to look at how to use, I'll show you some suggestions and I'll point you to resources where you can look at how you can develop this as something you can use, or perhaps suggest to patients who are interested in exploring it. Let's look at the problem of persistent pain that journaling is attempting to help with. So just to categorize or clarify what persistent pain is, in the literature, it's any pain that lasts as ongoing or occurring beyond 3 months. So it's past that normal healing phase if there's been physical injury. We know that some people don't actually have physical trauma to explain the onset of their pain, and often the many investigations they have are negative. And also we know when people have had physical trauma and we find normal degenerative changes through life, they can exist in people who have no pain. If we look at a broader perspective, thoughts, feelings, reactions around these structures or places in the body where people feel pain and that persistent pain, we might start to develop better opportunities to treat that 1 in 5 global population that currently suffer from persistent pain. What we know about persistent pain is 100% real. It's not in anybody's head. It's an embodied process. But recovery is possible. What remains with persistent pain that doesn't in pain that resolves is a sense of uncertainty, lack of information, and loss of control. Now, those 3 elements equate to the stress response. And that's often why we see persistent pain and its onset appear at times of overload in people's lives. And that's something that might have subjectively mattered to that person, that they lose or can't access or are not able to use anymore. There are times of grief or divorce or job loss or other times of physical injury. Its overload representing lots of different factors that might be important to that particular person. These are all situations that affect that sense of self-identity that the person is losing access to when these are problems that often happen beyond their control. And when we feel stressed like that, it's very natural for us to use default mechanisms in an attempt to feel better in that moment. When we do feel very stressed, when we're in pain, whether that's physical, psychological, or emotional situations, we have default reactions that help us cope with that moment: fight, flight, freeze, or fawn. And they're represented by lots of different behaviors that people demonstrate. And the best way in that moment for that person to cope with how they've interpreted what's happening. However, with persistent pain, quite often, repeatedly in that mechanism, the threat reflex triggers a behavior so fast that it's often beyond conscious awareness. 250 miles an hour, these reactive neural pathways can fire. But sometimes, if it's based on a belief that pain is due to damage and not the fact that the organism is using pain as a protective mechanism to slow itself down, that misinterpretation means that sometimes the behavior chosen by default is the one that actually becomes a driver of the pain. Let me give you an idea of how fast the threat reflex works in a human. So I'm just going to ask you to join in with me for a moment. Just take your hand and place it on your thigh and gently just rub it up and down on your thigh. Make sure it's your own thigh that you're rubbing your hand up and down on, otherwise it'll trigger a reflex in somebody else and you'll probably get thrown out of the auditorium. It should be where you just feel the fingers on your thighs are interpreting the pressure of your fingers, and the output is nothing other than a curious, I wonder what we're doing this for. Just compare a different version of this to one where, imagine you're in London and it's been a long day and you're tired. You're getting on the tube, you're not too sure where you're going to stay that night, you're looking for a hotel on your phone and it's running out of charge, and you just get into the carriage, the doors are closing behind you, you think you're on your own and somebody just gets in behind you, they're drunk, they're staggering around, they sit down next to you and they put the hand on your leg and they start to rub it up and down. Now it's a slightly different output depending on your interpretation. The stimulus is the same from touch, but as soon as the hand touches the leg, the output is very different. If you put a young baby in the same situation, the pressure on the leg of the hand pressing the leg with all those external cues present, the baby wouldn't really react any differently. That illustrates how fast the body goes into a reactive state, but based not just on touch or the stimulus we believe, there's lots of other factors that feed into that. That's what happens with persistent pain. There's thoughts around the pain, there's feelings, and their reactions to them. So with persistent pain, we have this loop of thoughts, feelings, and reactions that never seem to resolve the symptoms, and treatments based on chasing the physical structure alone often doesn't help. So journaling has the potential to break the loop. It isn't anybody's fault to have had these mechanisms in place. There should be no blame apportioned because they're not doing, often these patterns aren't happening consciously. Journaling allows potential pause in proceedings, thoughts, feelings, and rather than reaction, you've got the opportunity to engage in a calmer response. You start to access thoughts and notice the feelings around them. You can start to access the feelings and notice the thoughts that pop up about them. And the pen allows you to write. So rather than this 250-mile reaction, it's physiological reaction, the pen allows somebody to express those thoughts and feelings onto a piece of paper. You're almost discharging and disconnecting them from that loop mechanism that never resolves. What's happening is it's allowing the prefrontal cortex, our thinking brain, that maybe has played second fiddle to the unconscious patternings of reactions when it's needed to initially, but having that ongoing over the longer term serves nobody, and certainly not the person in that experience. So it allows the thinking brain to start taking executive control to understand that the feelings and thoughts that they're experiencing aren't relating to the present moment, and writing it down almost connects you with that moment in time that is now, and starts to express and almost metabolize those neurochemical matrix that creates that sense of being chased still and feeling overloaded and overwhelmed, and disperses it. This is a story of a patient who benefited from journaling for his persistent pain, and he felt it helped him completely resolve his symptoms. He had 15 years of low back pain. There was no trauma had its onset. It gradually came on. He was diagnosed with degenerative disc disease. He had loads of investigations and treatment that didn't offer him any lasting relief. He was told by a consultant surgeon just to carry on and manage it. It wasn't really something that was amenable to surgery. He tried everything to no avail. He was limited in all of his physical activities. He started to journal about aspects of his story and his life that he never really considered as relevant as contributors to his pain, and he started to notice change. He also benefited from other tools, explanations, and understanding. He felt it was the catalyst for him that helped kickstart his recovery. I'll play you this 2-minute clip so you can get his perspective.
One of the biggest things for me was to start to look at, I don't know if you've seen this journaling exercise, I mean, a few people talk about it, but where you look at your, from birth to now, all the stressful events along the top, or life events along the top, and then put it against any ailments, any illnesses along the bottom, started to map things, and things started to become evident. And then the journaling process is just, well, the one I read about was just free writing about that area at that time. In terms of, at that time in my early 20s, I was in a new job, out of university, just took a big old mortgage, wife pregnant. And then if I look further back, I had a good friend of mine die quite horrifically when he was 18 and I was 16. I've got very religious parents that lovely parents, by the way, but just some things in the religion didn't sit quite with me, and there were things that were happening from call it trauma nowadays, don't they? But just like life events that I'd realised now looking back that I hadn't processed, sort of, but just like you said at the beginning, not feeling the stuff. That I think that comes with that. Part of the problem is that super positive attitude is sometimes I would suppress things, and including what transpires through the journaling was that I hadn't grieved properly. I hadn't dealt with certain beliefs that were imposed upon me, and hadn't worked them out for myself. And all this sort of came out through this journal exercises. And for me, I see it now as 2 layers. I see it like I had all these like deeper repressed emotions and stresses on one layer, and then another layer of beliefs around the pain itself. So I had these like character traits that were causing me to be tense and not deal with not feeling emotions. And then I had a second layer on it, which was that I built up all this list of things I could and couldn't do for 15 years that had sort of created their own pathways and become true to me. And so I could only, for me, the best thing was the writing about both those different layers and I just found that the act of journaling just sort of slows the brain right down and gets what's in there out on paper. And then once it's on paper, I can start to analyze it. And that's what it was. So that's what I've just talked about. Took me a couple of years to work out through writing about the things I was noticing and experiencing.
I'll provide a link to the full video if you want to watch that in more detail, how Daniel explains how it helped him specifically. But safe to say, he's now running triathlons. He's not physically limited. He's in his early 40s. He's a healthy guy. He doesn't have any pain. And he has all those changes on the scans that the doctors told him with the reason for his pain. This is the timeline that he described. This is one of the techniques that you can consider to start doing, is creating an awareness between moments of overload or periods of time that might have been traumatic or challenging in your life. And it allows you to see when physical symptoms or illnesses might have appeared in the person's life. So you simply do a timeline from whatever age you want to start to whatever age you are now. You map out the physical symptoms and their onset, and you just consider other things that might have been happening around that time that might have asked you to push yourself harder than the norm, whatever that is, to try and cope with what was going on, whether it was physical demands placed on you, psychological, emotional challenges. Remember, all these things feed into overload of the system and can make us feel like we're being chased by a lion. And those moments can be the opportunity for the organism to use pain not as proof of damage, but as a mechanism to attempt to consciously become aware that we need to slow down and attend to ourselves. Pain is simply a signal to attend to yourself. These are some other techniques. So you've got the timeline that Daniel highlighted, and you've seen an example of that. Rewriting is picking one of those moments on that timeline, and for 20 minutes just writing whatever you feel or think in that moment, allowing the pen to guide you almost. Don't worry about neatness, about paragraphs, about spelling or punctuation. Just let it go. Write whatever comes to mind, whatever you feel, let it go. You can write to yourself at the age you were at the time of the incident. You can write to the people involved at the time. You can write to yourself now. If you are writing to somebody who's alive now, or you can never ever give them a letter or wouldn't ever want to, these are called unsent letters. If they are no longer here, they'll never receive it. And if they are here, but you wouldn't pass it on to them, you simply can rip them up. You're allowing the mind and body to process those thoughts and feelings and using their pen to express them. It sometimes can be helpful for people to look at an evidence diary. Daniel said he looked at rationalizing his beliefs and challenging some old ones. So building an evidence diary of when the pain comes and what it tends to be linked to. It can also be helpful to look at beliefs around pain. You're essentially creating an opportunity to explore thoughts and feelings in a way that is categorically safe. You are in no danger. Wherever the place is that you choose to do this, you're setting aside 20 minutes just to allow yourself to process some of these thoughts and feelings that are linked to how you feel about persistent pain. Professor James Pennebaker distills it down to such a simple approach, and he's the founding father, if you like, of this technique in the 80s. He distills it down to this statement: write about any experience you're worried about that keeps occurring in your mind. It's not a panacea for everything. You've nothing to lose and everything to gain. If you decide it's something you like to explore, you just need a pen and a paper, a time and a place. You're setting the scene and creating a state of calm to gain a different perspective on the thoughts and feelings that you might be conscious of, but some might pop up that you were never conscious of at all. The only disclaimer I'd make is to see a GP or another health professional if you've recently suffered trauma or you feel overwhelmed at the prospect of this approach. That aside, it's a lovely opportunity to consciously create calmer, safer, more rational responses in a way that rewires them, embodies them, and might just allow you to access a much more comfortable life. Here are some more resources if you'd like to look into these techniques in a little more detail. Daniel's wrote a couple of articles about trusting your body again, and also one about his recovery story. Michael Mosley does a podcast on BBC iPlayer. There's the full journaling workshop that Daniel and I did, and there's a couple of websites, SERPA, that's run by physiotherapist George Oldfield, who has lots of resources around journaling and many other techniques, and there's references to support this work on the psychophysiological disorders bibliography that's linked to also at the bottom. I'll happily answer what questions I can in the panel, and thank you very much for your invitation today.